Dr. Ho and I put together this educational video for physicians and healthcare professionals on MR-guided breast biopsy. The general principles about MR-guided breast biopsy illustrated in this video apply to any equipment commercially available. The equipment shown in the video is what we use at our academic institution and is listed here. We have divided the topic in 5 sections for easy reference. The first section, General Concepts, is a general overview that can be of interest to radiologists and physicians referring the patient for the procedure. The remaining 4 sections are for radiologists. The basic biopsy technique is an overview of the entire procedure, and the following 3 sections have technical tips and tricks for radiologists that perform the procedure. The duration of each section is shown here, and the links for each section are listed in the YouTube description of the video. This video is Section D, Tips and Tricks Part 2, on finer points about equipment for MR-guided breast biopsy. Tips and Tricks Part 2 is a supplement to the Basic Biopsy Technique section and provides additional information regarding the overall equipment and biopsy device in particular. The equipment shown in this video includes in vivo Sentinel breast coil, Aegis computer-aided software for breast MRI, Bard and Core Inspire biopsy device, and its compatible tissue markers. Let's review finer points related to the equipment. Multiple breast coils with biopsy capability are available commercially. We utilize the 8-channel in vivo Sentinel bilateral breast coil compatible with our 1.5 Tesla and 3 Tesla magnets. The coil allows for unilateral or bilateral breast procedures that can be performed with lateral, medial, and superior approach. The coil may be inserted in the scanner head or feet first. If the patient is introduced in the scanner head first, the superior approach cannot be used. The coil is utilized to perform biopsy, clip placement, and wire localization, and supports the grid, pillar post, and major approved vacuum-assisted biopsy devices. Dedicated breast immobilization devices include plates and grids. These are system-specific. Shown here are the grids and plates for our in vivo Sentinel coil. The top left plate is used for the superior approach. The top right plate is used for the lateral and medial approach. The grids have adjustable height to allow for biopsy of posterior lesions close to the chest wall. Each immobilization device has a locking mechanism to secure it in place during the procedure. Similarly to stereotactic-guided breast biopsies, vacuum-assisted biopsy devices are preferred for MR-guided breast biopsies to obtain adequate tissue. Several vacuum-assisted biopsy devices allow for a single insertion and subsequent multidirectional sampling with retrieval of multiple tissue cores. On the contrary, another type of vacuum-assisted device requires a separate insertion to obtain each single tissue core. Multiple biopsy devices are commercially available. We don't endorse one in particular. We use the Bard and Core Inspire 10-gauge vacuum-assisted biopsy device and its compatible biopsy kit and tissue markers. This figure illustrates the relationships of the different components of the coaxial introducer set, the plastic cannula, stylet, and obturator, and the 2 types of needles, the sharp needle and the blunt end needle. All the components inserted within the plastic introducer protrude beyond the introducer tip. The stylet protrudes to cover the entire length of the sharp needle. The obturator protrudes so the obturator tip ends in the middle of the biopsy device aperture. Both the sharp and blunt end needles protrude more than 2 centimeters. The needles have different length and tip, as the blunt end needle is shorter and not sharp. Both needles have a 2 centimeter aperture that can be adjusted to use for full or half sample depending on the lesion location and size. Numerous MR-compatible biopsy site markers are available through different manufacturers. The tissue markers come in different shapes and material. Shape and material affect the marker visibility on MR. When other clips are present in the breast, the clip shape is chosen to differentiate the clip in the same breast and identify the clip placed at each biopsy. A tissue marker comes in a rigid applicator and is deployed with a side or an end mechanism. This is the tissue marker that we utilize at our institution. It comes in a 14-gauge rigid applicator with an adapter that fits into the plastic introducer and a locking mechanism that prevents unintentional deployment. The tissue marker is composed of 3 microfiber absorbent pads of polyglycolic acid. The microfiber pads provide transient ultrasound visibility before they are reabsorbed within 12 weeks. The central pad contains the radiopaque marker that marks the biopsy site. The metallic marker is available in 2 different shapes and materials. This concludes Tips and Tricks Part 2 on equipment.